Welcome to the Samuele Tini Show and our Oppenheimer Research Conference 2025 special with live and on-site conversation with African researchers and leaders turning science into solutions for biodiversity, climate resilience, and livelihoods. The conference is organized by Oppenheimer Generation Research and Conservation, one of Africa's leading independent organization for African-led science. This year's theme is Preserving Our Precious Planet. We will explore biodiversity loss, landscape ecology, climate, wildlife economies, and heritage with African scientists for Africa. I am your host, Samuele Tini. Welcome to a new episode. Here at the conference, we are going now to interview another change maker, somebody that has been at the forefront of conservation in Uganda. I'm very pleased to have here today Dr. Gladys Kalema Zikusoka. Gladys, it's such a pleasure to have you here with us today.
Thank you so much for inviting me. And thanks for pronouncing Zikusoka, my name, so well.
Asante sana. and Gladys, I mean, your work and your reputation precedes you. You are an author. You have done wonders in conservation. But before going a bit deeper into your work, especially in the One Health approach, conservation, people, and gorilla, can you give us a glimpse, an introduction? Who is Gladys? How you have ended up in this world of conservation?
I'm a wildlife veterinarian and conservationist. I grew up with many pets at home, which made me want to become a vet. And then when I had an encounter with a monkey that imitated me playing the piano, I got fascinated by primates. Just a regular vervet monkey. And then when I was in my childhood, I happened to have lots of pets at home. And our next door neighbor acquired a pet vervet monkey. And that monkey imitated me playing on the piano one day. And I thought to myself, wow, they're so intelligent. Not only do their fingers and fingernails look like mine, but they can actually play the piano. Fantastic. So I started getting fascinated by primates.
Fantastic.
Then when I was in high school, I set up a wildlife club in my high school, and I took the children to Queen Elizabeth National Park at the time when there was very little wildlife because of poaching in the President Idi Amin era. And unfortunately, there were no lions or leopards, and there's very few elephants. So we could do a walking safari. And it made me think that maybe I should become a vet who brings back the wildlife to Uganda.
Fantastic.
And so after studying at the Royal Vet College, University of London, I came back and became Uganda's first wildlife vet.
Fantastic. Fantastic. That's an incredible journey. And then how you started also your work with the gorillas.
Yes.
What brought you there with the great apes of Africa?
Well, when I was setting up the wildlife club, I visited the wildlife club offices, actually before even setting it up. But when I was volunteering at the wildlife club offices in the capital city, Kampala, a certain warden came in and very excitedly said, "We have mountain gorillas in Uganda."
Wow.
And I was like, wow, I'd love to see them. And then he said to me, no, they're not yet habituated. No one can visit them yet. He kind of planted the seed in my head. And while I was at vet school in the UK, some people came and presented about working with mountain gorillas in Virunga National Park. They were working in volcanoes at the Mountain Gorilla Vet Project. It's called Dr. Barclay Hastings. And Ian Redmond was working with the late Dr. Dan Fossey. So they told me, they gave a talk at the vet school about gorillas and donating anesthetic equipment. And then I said to them, I want to work with gorillas in Uganda, but I would love to visit your project. And they said, no, you can't come because, there was fighting and everything. But later on, I got an opportunity to study the gorillas in Uganda as part of my undergraduate studies as a vet student. And that was really fascinating. I spent 1 month in Bwindi Impenetrable National Park, 1 year after gorilla tourism had begun. Fantastic. So it was a very exciting time to be there.
Wow.
Because there was this big air of hope that tourism was bringing. People were expecting a lot. It was really changing people's lives already. Former poachers had become rangers and trackers, and they were earning more looking after the gorillas than poaching them.
Exactly.
So we actually called them born-again poachers.
Fantastic.
And then also the lodges were hiring people. The nearby hospital, everything was happening. There was a whole infrastructure.
That was developing a bit.
Because of the gorillas. my research showed that the 2 tourist groups visited by gorillas had a higher parasite burden than the 1 research group visited by researchers. And so I started realizing tourism could have an effect on them. Either they're stressed, so they can't, their parasite burden goes up, or it could have a negative effect. But then I also saw how the lodges and the jobs were being created because of tourism, which was reducing the threats to the gorillas. And of course, one of the biggest threats was disease. And so when I saw that you could get so close to them and we could easily make them sick, and also that their forest habitat was really cut, it was getting smaller and smaller, I thought to myself, why don't I become a vet who also treats gorillas?
And that is where I think you realize, no, the eureka moment to see the conservation and public health and your One Health approach. Can you discuss a bit more about it?
So when I was hired as a first veterinary officer for the Uganda Wildlife Authority, Uganda government, one of the first cases I had to deal with within 9 months of the job was a scabies skin disease outbreak. They told me the gorillas were losing hair and developing white scaly skin. So I asked a human doctor friend of mine, what is the most common skin disease in people? And she said to me, it's scabies in rural communities because people have less than adequate hygiene and less than adequate healthcare. So it was a 10-hour journey from Kampala, and I was able to carry ivermectin with me. And we got there luckily the first day that we went to treat them, I went with a vet from Kenya who had come to support us on veterinary needs for the Uganda Wildlife Authority. So he had seen scabies in cheetahs in Masai Mara, which are being visited by very many tour vehicles. And so we thought if they do have scabies, it could be due to stress. And when we got there, it turned out that they had scabies. And so we treated the gorillas. Sadly, we lost a baby. But even after the baby died, the mites were still crawling. The others recovered, and we started to ask ourselves, where could it have come from? Another gorilla group got another scabies outbreak. And it was also a group that ranged outside the park a lot, raiding people's crops. Because when gorillas go into community gardens, they find dirty clothing on scarecrows. And they're curious, so they touch it, and that's how they got the scabies. And so I thought to myself, why don't we set up an NGO that can improve the health of the people and the gorillas together, because you could not keep the gorillas healthy if their human neighbors had less, were unhealthy. Yes. So that kind of started the whole conservation through public health idea. And a few years later, we founded it in 2003.
Fantastic. How you have developed the idea towards that, and how you have also integrated the community angle, the public health angle, to really have a more holistic approach that takes care of conservation, but also the community surrounding the areas.
Yes. So when we started CTPH, we realized that we needed to look at the health of the gorillas and other wildlife and the health of the people together. Which in those days hadn't yet been called One Health, but it eventually became called One Health. And so what we did is, with the gorillas, we collect samples every month from their night nests, and we examine them for diseases that they may have or they may have picked up from the local communities or their livestock. So we have a gorilla health and community conservation field laboratory that regularly analyzes samples from the gorillas. The people, we started a conservation education program and behavior change communication to improve their public health practices and their conservation attitudes and practices. And so we work with community health workers and teach them to do conservation work.
Fantastic.
Actually, when we started around Windy, there wasn't any community health workers. It's so remote. Wow. So the first volunteers we worked with from the community we taught them to do both health and conservation together. But later on, the government village health team system reached Windy. So when we scaled up around the forest, we just got all the village health teams eventually, and turned them into village health and conservation teams. So as I speak now, we have 430 village health and conservation teams who work in 59 villages around the park, reaching over 50,000 people in 10 households. Fantastic. So it's grown over time. We started off with 2,000 homes and 26 volunteers, and they promote good hygiene and sanitation. They make sure people have hand washing stations outside their toilets. They have a proper toilet. They also promote family planning use so that they can have manageable families. That started a few years after, when we realized that many people had very many children. They couldn't give them proper health care. And also they couldn't give them enough food, so they have to enter the forest to poach. So it became a food security issue as well. So now you find that they've dropped from 10 children per family to 4 to 3. So we're seeing that happening because of our programs. And we're very excited about
the
that.
approach when you presented it with the posters, and now you also used, form of communication that reaches the people,
Yes.
on those.
Just images with no words, but it was based on real stories, storytelling. Because when we developed those flip charts, we did it together with the community volunteers, the first group we had. We created a set, sent it, gave it to them. They gave us ideas and said, no, this happens more in our community. So they owned it. And so now when they go to the communities, it's easy for them to show the bad family that gets everything wrong, too many children, When the gorillas come out, they try and chase them. They're poaching. They're desperate. Only half of them are going to school. The others are for chasing wildlife from the garden. And they have very poor outcomes, both for conservation, public health and development. The children die. Things are getting worse. Trees are being cut. Life is getting harder for them. Whereas the good family, they only have 4 children. They plan for them. When the gorillas come out, they call the human and gorilla conflict team. They're all going to school. Eventually, the girl becomes a nurse. The boy becomes a ranger. And it's all based on reality.
Real stories that you have in your work. And I really want also to discuss, you have even expanded more now, because we know that tourism can be an erratic sort of, especially now with the COVID experience and others. So I see you also have now ventured into a social enterprise, the Gorilla Conservation Coffee. So how you have integrated also that into livelihood and then to a more holistic approach?
Yes. At first, we just focused on the health of the communities. But then we realized that many people were also poor. And when the poorer they were, the lower their health indicators. And it made us realize that healthcare is another, poor health is another dimension of poverty. And we found out that there were, and actually we were encouraged already by that One Health approach, because as community health was improving, gorillas were falling sick less often from diseases in the local community. Even if they go to someone's garden, they're less likely to get sick. So then we thought, why don't we start supporting the coffee farmers bordering the park? Because whenever you'd visit gorillas, you often cross coffee farms and people planting coffee. And when I found out that they're not getting a fair market or a steady price, and they were still entering the forest to poach, we thought, why don't we start supporting them? And then my husband, who's also a founder member of the NGO, Gladys Zikusoka, he's like, why don't we build a global coffee brand? And so we're able to sell the coffee outside Uganda to tourists. And it's really worked, because actually Uganda is famous right now for 2 things, coffee and gorillas. So Gorilla Conservation Coffee was a good way to really build a brand. And so we started to support them. And what we do, we basically we work with agronomists who help them to grow the coffee properly, harvest it properly. A lot of it happens during harvesting. You should only pick the ripe cherries and it has to be selective harvesting. The ripe, not the raw or the overripe. And then once you've collected it, it's processed properly. And we only buy the good coffee from them. Fantastic. The one that sinks, not the one that floats.
Fantastic.
And then we give them a premium price. Our price doesn't change. We always give them above market price for good coffee. It's almost like a conservation premium.
Yes.
And we told them that, no cutting trees. This is a conservation business. Turn your farm into a conservation cause, conservation business. And they're okay with it because they see how much they're benefiting from the gorillas. So we also teach them agroforestry, like they plant shade trees, because actually with shade trees, they get better quality coffee, better cup. And also it gives them food security if it's food trees like avocado or bananas, things like that. And then, so we have a team of people who teach them all that.
Fantastic.
So once we bought the coffee from them, it's processed further. Some of them, we get it, if they know how to do it, they have pulpers, we buy it at parchment. Yes. Others, we buy it at cherries. And then a donation from every bag of coffee sold goes to support the programs of conservation through public health, which is community health, gorilla health, and conservation education. So we're providing sustainable financing for conservation in that way. And we started off with 75 farmers, of which only 5 were women. This was about 10 years ago, in 2016. And now we're working with 630 farmers, of which 230 are women. So we're really excited that the women coffee farmers we're really engaging them. And because that was something we wanted to do. Fantastic. Some of them are former poachers. So they're actually much happier, like growing coffee than poaching, not having to depend on the land to survive. And we're trying to also get youth involved as well. Yeah.
Because that is an important discussion. And I mean, from your perspective, now you have been at the forefront on conservation of this iconic, great ape, the gorilla. I mean, is one of them, and they are more and more endangered. So how do you see their future? Do you still have a future? Are the number increasing? And can we have a growing countries, growing development in our region, but of course also conserving these iconic animals?
I can say right now that tourism has saved the gorillas. It's saved the mountain gorillas because it's the only gorilla subspecies that has tourism, viable tourism. It's the mountain gorillas. And it's the only one that is not reducing in number. It's increasing. Because tourism provides an economic incentive for people not to kill them if they come to their garden to raid their crops. They're learning to coexist with the gorillas because of all these incentives. Improved veterinary care has really helped so that more gorillas survive. Having veterinary care means that we're having many more gorillas surviving.
Exactly.
And it's shown that actually veterinary care has helped the numbers to, the populations to grow more. Then also with the communities, we're finding that improving community livelihoods through tourism, gorilla conservation, coffee, and different, people can sell crafts, accommodation, meals, the whole tourism industry. And better, because the money from tourism also helps with law enforcement, patrolling the park, paying salaries for the staff who then go out and patrol the park, all of that. And it helps with research efforts, improve research. All of that has contributed to the positive growth trend of the mountain gorillas. So now as we speak, the numbers of mountain gorillas, when I first started working with them, there were only 300 in Windy. And now there's a minimum of 459. We are expecting over 500 after this gorilla census, which the last one was in 2018, and there's one ongoing now. And actually in 2018, they were dropped from critically endangered to endangered because they're showing a positive growth trend. Although there's only just over 1,000 left in the whole world. 400 and about 460 in Windy and 604 in Virunga. So there's still very few mountain gorillas left, but the numbers are going up. And that's why IUCN dropped the status. So that is really good. But now the biggest problem comes about with tourism. Too much tourism is not good. Because obviously the tourists get too close and they can make them sick. So during the pandemic, we made it that everyone has to put on a mask when they visit the gorillas, and it's continued beyond the pandemic. Because during the pandemic, they got less flu and other diseases. Also, we're trying to get people to really keep that distance, not to be too close to them. Because number one, you can enable them to have a proper behavior that you can observe, but also you're reducing the risk of disease and injuries, actually.
Fantastic.
Yeah, so we're looking at that, and we do a lot of tourism education to the tourists, to the tour operators, and getting the rangers to manage the tourists properly. Another part of it is making sure the tourists visit the community members and buy their crafts and, support them. Because when a community member meets a tourist, they're much less likely to poach. So the biggest issue now is that the numbers are growing, but the forest is not growing.
Exactly. That is.
So they're running out of space. And you find that the habituated gorillas are the ones that spend more time outside the park. Like, as in, once you habituate a gorilla group, a gorilla family, it's more likely to spend time outside the park than not. Because now they've lost their fear of people and they're going back to places they used to range before. And so there's more human-wildlife conflict as a result of the numbers of gorillas increasing because they've run out of space.
Exactly.
Gorillas increasing, losing fear of people, it's led to an increase in human-wildlife conflict. People tolerate them because they're benefiting so much from them. Schools have been built, hospitals, roads. It's really that the future of the community has changed because of the gorillas. But so now what we're doing is we want to expand the protected habitat for the gorillas. So we're talking to community members who are willing to sell their land so that we can expand the habitat. And it's a big fundraising effort that we're trying to do as an NGO. And because we feel that that's the longer term option. Yes, there are gorilla guardians, human gorilla conflict resolution team members who chase them back whenever they come out. But that's just a short term measure. And because the biggest issue is once the lodges become so many, then there won't be space for the forest to expand.
Exactly. Yeah. And that's why, you also need now to an approach where you can restore, the habitats that has been lost in all this. Yeah.
Exactly.
Even your talk was fascinating, and I'm sure also the people can also catch up with all your story. I mean, I've seen a wonderful book that you wrote about walking with gorillas.
Yes.
I think that is a is a read that we can recommend to people that want to know more about your wonderful story?
Thank you. Like working with gorillas working with gorillas talks about how I became a conservationist, then how I became a wildlife veterinarian, then how we started the One Health approach. One of the very first One Health food programs in the whole world actually began with our work in Uganda, the mountain gorillas at Bwindi. And then also talks about how we sustain conservation through tourism, enterprises like Gorilla Conservation Coffee, which are eco-friendly agro enterprises, engaging women in conservation. When I started out, there were no female rangers. Now 20% of the rangers are female.
Fantastic.
There's more and more women in conservation. Half of our village health and conservation teams are women and half are men. So women are getting more involved in conservation and natural resource management, and men in healthcare and family planning.
Fantastic.
So that's something that we're very excited about. Also, the One Health, engaging the next generation. So I talk about all the different things we've been doing and the challenges of being a woman in conservation. I actually talk about Dr. Jane Goodall. She's one of the role models or icons that tells that story, because she went out in the 60s when it was really unheard of for a woman to go in the bush, alone to do those things. And she was a mentor of mine. I'm so excited she wrote the foreword for my book. I hope you enjoy reading it. It was a very nice foreword. And I also talk about the role my mother had in my life, encouraging me to do something that was unusual in Uganda because I wanted to do it, just wanted me to follow my dreams. And she's also a pioneer in her field, a leading politician, one of the first female politicians in Uganda who opened doors for so many women to join politics. Yeah, so she passed on in August, Dr. Jane Goodall in October, and also the nation mourned with us. Yes. She got an official state burial. And same with Dr. Jane Goodall, the whole world has mourned. And they're icons. Actually, Jane Goodall gave her an award, and me, and our NGO in 2018, because Jane Goodall was also into promoting women empowerment.
Fantastic. And I think you are honoring their memory and really taking their legacy and also creating the future generation for conservation in Uganda, and not only in Uganda, I think in the broader region. It's been an honor and pleasure having you. And thank you so much, Gladys.
Thank you, Samuel. And I hope you come and visit us at Bwindi and see the work we're doing and really get into it.
Asante sana. Nashukuru.
Asante sana.
Are you satisfied after this wonderful episode? Let's continue together our sustainability journey.